Welcome to our fourth Global Health Report, Countdown to the Olympics, Day 2. Japan's gamble to hold the Olympics within a pandemic, which is the first in history, has become progressively riskier rather than less. Perhaps the most glaring among many vulnerabilities to the pandemic is a low national vaccination rate in the host country of the Olympics, placing the native population largely at risk. In our third Global Health Report, Countdown to the Olympics, Day 15, we made many important observations that were turning points for the safety of the Olympics, including the safety and wellness of the athletes, any spectators allowed to participate, low vaccination rates, and a global surge in COVID-19 cases, largely fueled by the Delta variant. There are many important epidemiologic factors that can help experts gauge the expected trends: number of new cases, hospitalization rates, and the test positivity rate, which is the percent of new positive cases. In our last Global Health Report, we showed concern about rising new cases in Tokyo. This chart shows expert estimations of best and worst case scenarios regarding new cases in Tokyo based upon crowd size assumptions and flow of people. You can see that it was estimated that by the time this report was completed, July 21, 22, slightly more than 1,000 new cases daily was expected. However, the actual case number is now above 1,800. We also reported that Tokyo is actually in a state of emergency due to COVID-19, and we presented this slide showing the potential downward trend of new cases that emergency declarations may initiate. However, now at Countdown to the Olympics -2 days, we report a steady increase in new cases. Again, over 1,800 were reported yesterday. The test positivity rate, or percent positive rate, has risen sharply in Tokyo to over 10%, increasing 2% over just the last 3 days. The World Health Organization has established 5% as the marker for allowing governments to consider reopening after taking draconian control steps. Although the WHO Director General stated that the world is presently failing its pandemic test, he also stated that the mark of success is making sure that any cases are identified, isolated, traced, and cared for as quickly as possible, and onward transmission is interrupted. He also stated that the mark of success in the coming fortnight is not 0 cases regarding the 11,000 competitors staying at the Athletes' Village in Tokyo Bay. Face masks are controversial. I have personally admired the Japanese for wearing face masks traditionally to prevent the spread of disease when symptomatic, long before the pandemic. While the tradition to wear masks to protect others from disease is strong in Japan, like many Americans, those same people seem to ignore the fit of a mask to prevent infection from others. This well-dressed person wears a mask in public. While admirable, you can see that the mask is not tight-fitting, and it is worn over a full beard. If he is fully vaccinated, this is simply very protective behavior. If he is not, he is at risk. Recently published research on the Delta variant shows that along with its far higher infectivity, the viral loads transmissible to other people may be 1,000 times greater, posing a severe consideration for face masking and social distancing strategies. It is important to consider our present state of pandemic fatigue and vaccination, and that a single vaccine shot in its host may actually be an advantage for Delta. Therefore, we are back to a similar predicament that we were in early pandemic, when the novel coronavirus was incompletely characterized. Of course, CDC reversed guidance for airborne transmission several times, settling on the confirmation of aerosol transmission in late 2020, later establishing that 6 feet may not be a protective enough distance indoors. In our May 2020 publication, in the National Environmental Health Association's Journal of Environmental Health, written in April, we established this diagram to portray a best available understanding of disease transmission pathways from an all hazards perspective, meaning the utilization of other comparators, especially SARS, MERS, and even the norovirus. In Figure 1, Pathway 1, person to person, we consider aerosol and droplets, and the surfaces upon which they may settle in a room polluted by them. We will be continuing our threat analysis and transmission pathway descriptions as the Olympics begin, and we will follow the 339 events covering 33 sports. By July 15th, a total of 45 new cases were reported among the Tokyo Olympics athletes and staff. At the Athletes' Village, even if COVID-19 positive people are discovered, nationality, gender, and other identifiers will not be disclosed. This was described by local Japanese. There is only distrust, according to the Mainichi Shimbun news source. According to Reuters, an Olympics Nigerian delegate was the first hospitalized with COVID-19 on July 16th. 3 USA basketball players have tested positive for COVID-19 since the onset of the team's training camp in Las Vegas earlier in July. They will not fly with the team to Tokyo. Additionally, tennis superstar Coco Gauff tested positive before traveling to Tokyo. Continuing our global surveillance, Sydney has tightened its lockdown as cases rise, according to Reuters on July 17th. It is estimated that nearly one-half of Australia is now in hard lockdown. Malaysia has shut down a vaccination center after 204 staff became infected, according to ABC News on July 13th. The United States issued new travel restrictions to the United Kingdom, as shown in this July 19th, 2021 posting. Americans are advised to avoid travel to the United Kingdom. And further, it states that if you must travel to the United Kingdom, you must be fully vaccinated before travel. However, in sharp contrast, on July 18th, coronavirus restrictions were lifted for those in London as many returned to a party atmosphere once again. This has been an All One Health Systems LLC and Institute of Wellness LLC production. Please subscribe to our channel.